Healthcare professionals around the world are sounding the alarm as new research reveals antibiotic resistance is on the rise. Nearly 3 million cases occur each year in the United States. Listen to this, resulting in about 35,000 deaths. And researchers say that children are especially vulnerable. Research shows that common illnesses like pneumonia and sinus infections could become harder to treat. It's why Murdoch Children's Research Institute is doing their part to fight it. Dr. Penelope Bryant is an associate professor and leader of clinical infections. She joins us now. Dr. Bryant, as a mom of 3, this really blew my mind. 3 million children in the United States with this antibiotic resistance, 35,000 deaths. What should parents look for?
So I think just as a quick reminder for everybody, antibiotic resistance is when bacteria put up their defenses and our usual go-to antibiotics stop working, and that makes common infections harder to treat. And what we found in this global study is that for children all over the world, including the United States, antibiotic resistance rising everywhere, and that worldwide already over 1/3 of childhood infections are resistant to at least one first-line antibiotic.
Dr. Bryant.
So as a pediatrician and a mum myself, you're right, like you. I hear from parents all the time that, antibiotics are sometimes needed, but you're also worried about giving too much antibiotics to your child, worrying about resistance and impacts on your child's gut microbiome. So there's a few practical steps that parents can take. So the most important thing is for parents to feel that they have a voice in their child's health, and to have a conversation with your primary care physician about why antibiotics are or aren't being prescribed for your child this time. Many infections are caused by viruses and antibiotics just don't work.
And Dr. Bryant, when you look at some of the drivers of this, we'll put them up on the screen: overprescribing antibiotics, not finishing your prescribed course, and poor sanitation. One of the things I was also reading is that unfortunately children are underrepresented in clinical trials, so it becomes hard to get research like this with that as a factor.
Yeah, so that's exactly right. And particularly in high-income settings like the US, it's about focusing specifically on children. So there are some broad things that help, but for children specifically, there are a lot of antibiotic formulations that are just disgusting. I don't know if you've tried any of them, but they really are horrible. And so we need more of those. We need better dosing information for children and more funding for studies on children reducing antibiotics.
No doubt. And then also I was looking at the fact that this spans all across the globe. This is not, to one section of the world. Geographically, this is something that the whole world's dealing with. I mean, 3 million cases in the United States. It defied logic to me because this is not something I've heard about it in adults, but not among children. It's not something I've heard about from my pediatrician.
Yeah, so I think that's why it's really important to highlight, and really appreciate you guys highlighting it, because we know that there's a bigger problem in low-income settings, but bacteria don't respect country borders, so this really is a global problem, and this can be seen on the website that we've created to share the findings, amrinkids.com. And what we're seeing is that resistance to first-line antibiotics in really common childhood infections such as urine and ear infections is rising, and we can't rely on new antibiotics being developed as the pipeline for this has really slowed down.
No doubt. And Dr. Bryant, the producers just updated that our opening script said it was 3 million children. It is 3 million adults and children. So I wanted to put in place that correction. Dr. Bryant, thank you so much for your help. Well, to learn
really
more,
nice to talk to you. Thank you for having me.
Of course. Visit go.fox/MCRI or scan the QR code on your screen. Well, more Fox and Friends.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox 1.